Expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning. We're having a good time here. We're sleeping. We're sleeping because we're going to talk about sleep apnea.
Sleep apnea. You know, when you go to sleep and your significant other is there.
No, my significant...
We think it's something funny, but it's something very serious.
What breaks up marriages, you know, I mean, when you really get down to it, some people start to go in another room.
You have 2 rooms.
That's right.
Yeah, instead of 1 bedroom, you need 2 bedrooms.
It is true. It's not one for sex and one for sleeping. Here we go again.
Here we go again. We're talking about something so serious like the New York Times.
Okay. It is serious because you told me something amazing this morning that
There were some new studies that just came out. It was reported in the New York Times. So if you Google the New York Times, and what they noticed that people who suffer from sleep apnea has a higher risk of developing, guess what? We know about hypertension, diabetes, coronary arterial disease. What the new study found is that they can also develop the big C. People can develop cancer because of sleep apnea.
And I asked Dr. Mencia, by the way, I'm Anita Finley, and of course this is Dr. Andy Mencia, who is the founder of the Adult and Geriatric Center, and he comes here every Saturday morning to make you know more about health and for you to consider going and meeting him and having him as your physician. So after I talk about that, I wanted to ask you, people who have sleep apnea probably don't even know it.
They don't even know it, exactly. Especially if you live alone. Or if you live in a retirement community, if there is no another person next to you that will notice a few things. Number 1, that you are snoring at night when you sleep. Number 2, there's 2 types of snoring. You have the snoring when you are falling asleep, and usually that's induced by medication. And then you have the person that starts falling asleep and going to a deep sleep, and then they start snoring first. Then they stop breathing. And that's the important part, that when you look at a person, if you live with a significant other who snores at night, if you look at their chest wall and you see that the chest wall is moving normal, then they start snoring, then they stop breathing altogether, then that person, without you doing any more study, that person most likely, more than 90% certainty, suffer from sleep apnea.
Now, sleep apnea, Dr. Mencia said that when he came in, he was going to talk about it. I said, what actually is sleep apnea?
Yeah, dyspnea means like you have problem breathing. So apnea means that you have the absence of breath. So it's basically what it's saying is that during your sleep, you're going to stop breathing altogether.
It sounds dangerous to me.
It is very dangerous because, we depend on oxygen. And oxygen comes through the lungs. And the lungs are connected to the outside world by the breathing pipe. So when you start snoring, what happens is that the muscle where you have the uvula and where the tonsil belong and all of that, those muscles relax so much that the tongue will drop backward and will close the breathing pipe altogether, 100% closed. So it's like somebody put their hand around your neck and squeeze it really tight so you can catch your breath. So because you cannot bring oxygen inside, then 2 things are happening in the blood system. Number 1, you are not getting oxygen. Number two, you are retaining your carbon dioxide, which is a toxic. You're trying to get rid of carbon dioxide with every breath. So by retaining carbon dioxide, being a toxic, you develop radicals in the cells throughout the entire body. And then those radicals, as we all know from all kind of study, are the ones that will make you prone to cancer.
Well, that does, I know you said there was an article on that, but of course you're very smart and you probably knew this anyway. You just didn't think
never
about
put
it together.
Oh my God, when I saw the title, I said, I'm so stupid. I should have thought of this before.
Well, I'm not so stupid. You're just doing too many things. But let me ask you a question about that. So I know that you pride yourself when someone comes in to get a full description of their life and their health.
Absolutely.
Do you ask them about snoring? Or?
Yeah, I ask my patient, do they have problems snoring? As a matter of fact, I had a couple this week. Not because of the article, but this week I had a couple. And when I'm talking to the patient, I say, any problem with your sleep? And the main complaint was that he said, I'm so tired during the daytime, and that's not me. So he listened to the show and he say, I think, maybe my B12 level is low, like you say on your radio show, so I want to get checked. So then I started questioning him about his sleep. He said, oh, no, I don't get a good night's sleep, but I'm okay. And then the significant other sitting there saying, no, you're not. You snore at night. And yes, Dr. Mencia, he does stop breathing at night. I said, oh, he stopped breathing at night, so he snores at night. So most likely this person is suffering from sleep apnea. Because remember, when you have sleep apnea, if you don't have oxygen, you have a lot of CO2. CO2 is going to motivate the cell to produce lactic acid. And then lactic acid don't belong, especially in the muscle cell. It gives you a lot of pain. So here come the chronic fatigue and the fibromyalgia and all those other conditions that can be induced for the lack of a good sleep with sufficient oxygen being exchanged for the carbon dioxide. So I do ask my patient when they come in, I try to do a thorough checkup in the first few visits to make sure that we cover all ground with the patient. And that's the beauty of the practice, having the neurologist there, having the ophthalmologist, the dermatologist, having all the consultants, the hypnotherapy, the dietitian. So in that particular patient that I saw this week, and having read this article, then I asked my patient, I want you to see Nicole, the dietitian, and we're going to work on a weight loss program. Because he's about 70 pounds overweight. So we're gonna work on a weight loss program so that you don't have to put a machine on to help you breathe.
Now that was my next question. Okay, but in the meantime, a machine. Do you want them to have the machine until that happens?
It depends how bad it is. Yeah, it depends how bad and how motivated the patient is, how advanced they are. If I can motivate my patient to go ahead to exercise, you want me to go and hug you over there?
No. I was wondering if she's cold. They don't even know we have this one of your beautiful employees here in our office.
Yeah, Ina she's been doing so good. Ina is making the Saturday schedule so popular. Pool Wheel is having a hard time. All of the patients, they come in and they say, on Saturday, they say, oh no, I want to keep coming on Saturday. I want to see the beautiful Russian woman.
No, she is beautiful. And that's a good thing, maybe just to divert for 1 second. Saturday, there are very few medical offices that are open on Saturday. In fact, many of them on Friday close at 1, which is ridiculous,
That's right.
But it's horrible. It's horrible. But you have been so terrific to open all day Saturday he rushes out of here right after the show, so from 9 till we are there till 5 sometimes? Or whenever on Saturday.
Well, yesterday, what time did we leave yesterday?
Late.
6 something, or past 6 o'clock.
But on Saturday, you're also there late in the afternoon.
Saturday, as long as patients are coming, we are there. We don't
Fantastic.
go.
Let me give
Sometimes we are doing like aesthetics. People like to do it on Saturday.
On Saturday.
So like long weekend are very popular for aesthetics. So people want to get their face done, and by the time they go back to work, they want to look brand new.
Brand new. Okay, well, let's do this. Between your sleep apnea and your beautiful face, you're never going to be the same. This is why you have to go to Dr. Mencia's office. Dr. Mencia comes here looking like a shining star every Saturday morning. It's always amazing to me.
Shining star, you can see. Go, Richard.
Okay.
Give me some background music.
I was telling them about seeing this HBO show last night, Burlesque with Cher, and it was just so fantastic, and so got us all to a good start here. Let me give everyone the phone number. Remember, this is Pencil Talk Radio. Please get your pencils and write this number down. You need to really call for an appointment, and if you want to go in on Saturday, you just call them. There's someone there who will be answering the phone, and maybe they can slip you in if you really need to do this today. But otherwise, you have to make an appointment.
Well, remember that Sunday it's gonna be hard to find a doctor. On Monday, all the offices are closed.
Absolutely.
So if you need something, please don't wait. Especially for my patients that are already established, you need refill on medication. Anything that you need, we are going to be there for you guys.
Very good point. Thank you. You're such a kind person. You really are. Okay, the Adult and Geriatric Medical Center, the phone number is 954-489-1345. 954-489-1345. And they are located at 1608 East Commercial Boulevard in Fort Lauderdale, which is just a little bit west of Holy Cross Hospital. That's how. Anyway, it's very close.
Dixie and,
and Holy Cross.
Yeah.
Let me ask you a question. So, if you do have a patient and somehow they didn't get in today and they are in trouble, they call, and is there a way that you would?
There's a live person answering that phone 24/7, and
really?
there is always 24/7. We have one of the physicians or nurse practitioner on call.
Fantastic. Oh, that is so wonderful. And
this weekend, I'm not going anywhere. I'm going to be in town, so if anybody needs anything.
Something really bad. Well, let's hope that you go now if you're starting to feel bad.
I love what I do.
I know you do.
I love just
I know you do. You really do love what you do. It's so obvious in your face and your whole, the way that you are. Everyone knows that. I mean, I don't have to tell anyone that. I mean, you are. You're a very special person, and we love having you on. I want to continue with the sleep apnea because I think there are a lot of people who have seen these movies where you have to go lie in a room and they watch you sleep. Tell me about all that.
Well, yes, the sleep study centers, basically they are usually organized around a hospital, inside the hospital or part of a hospital. Then they move into having freestanding sleep centers. And nowadays, we even have machines that can be brought to your home, and you can do the sleep study. Usually, you will bring the machine home for 3 days, and the patient will come to the office. We provide them with the machine. They take the machine home, and they put it on, and everything gets recorded. Then it gets downloaded into the computer, and then you can see the oxygen content, how much the oxygen is dipping. When we look at all the parameters, then we can determine if the person meets the criteria for sleep apnea. And also, of course, then we want to look at the medication that they are taking. Now, remember that in the study we just cited from the New York Times, having sleep apnea increases the risk of cancer almost 5 times. 4.8 times.
Amazing.
So almost 5 times, and we're going to do an article for those people that, because the terminology might be difficult for you to follow. So Anita and I, we're going to have an article ready for you on one of the issues coming up on the on Boomer Times. Now 5 times. Now let's go back and look at the study, and what they notice is that it doesn't take much to produce damage to your body. So if anyone here in the studio get a oxygen saturation check, most of us here being normal, having no breathing problem, we are going to be between 96 and 98 or 94 and 98% oxygen content when we check your oxygen. So that's when they put the little thing on
is that what they're doing when they put that little thing on your finger?
On your finger, we're checking the oxygen and your pores go through your finger. So between 94 and 98 is average for most people. If you exercise, of course, it's going to go up to 100. You won't go higher than 100. Now, in the study, they only had to drop from 94 to 90 or just below 90. And when they drop below 90, the second question was, well, for how long do they have to be below 90? If you sleep for 8 hours, do you have to be below 90 for 8 hours or for 4 hours? It's only 12% of your time asleep. That means that maybe an hour of 8 hours that you desaturate below 90 is sufficient for you to have a 68% risk of cancer.
Oh, my. That's amazing.
So that was very significant. That was a high impact. And, me as an educator, as a physician, I say this is something we have to talk about in the show.
Well, yeah, I know you're an international champion of Tai Chi. Do they? Taekwondo. I'm sorry.
Taekwondo. It's okay.
Excuse me.
We are all family.
Taekwondo.
We are family.
Well, now that you're having so much fun, I'm going to tell you something. You know that little thing that you put on the finger? I figured when I had that put on, they were testing my sexual prowess.
Yeah.
I didn't know that it was for my oxygen.
Yeah, no, I
was waving my finger.
One of my patients say, "What is that little thing on my finger there?" I said, "Just want to make sure you're not lying to me."
Because no one ever tells you when they put that on what that means, and that's what it is, right? Okay, let's go back into. I had to laugh when you said this, but just talking about this is pretty shocking to me. So. I don't want to go back to the machine. So let's say someone's listening and they are concerned about having sleep apnea, and you examine them and say yes. Will you order the machine?
Absolutely.
And will Medicare pay for something like that?
It will completely covered by insurance.
And it's
all
not
insurance,
dangerous that they go home. It's just like a machine. They just put something on their face and they plug it in, or what? What actually?
No, it's very simple. It's like have you seen those little cannula that you put in for oxygen?
Yeah.
It has
That's all
like
it
that.
is?
Yes, it's very simple. It's a very now remember the one you take home.
Right.
It's the simplest machine compared to the one when you go to sleep center. It's not the same result.
So is it as accurate?
But if there is a person that say, well, I have problem not sleeping in my room. Right. I'd rather stay in my room, in my bed, and get the study done there. It's not as accurate. It's not the same
It's not
thing.
as accurate.
It's not like, for example, it's big difference between getting your blood pressure check at your doctor's office versus getting a check with a little machine at home.
Really? Why is that true? Because I always check mine at home.
Well, yes, but the reading can be really high when in reality your blood pressure is not high, or it can be read as really low when in reality your blood pressure can be normal. So it can fluctuate a lot. The machine, the blood pressure machine. The one in the office, because it's all based on mercury, looking at the column of mercury, is what we still consider the gold standard for any study that we do that is research related.
That's now see, that was something else to tell everybody about. So going back to sleep apnea.
I have one of my patients, he's 98, and he said, Dr. Mencia, my blood pressure is well controlled and everything. Do you think I still have to come every month to see you? I say, if I'm 98, I will say yes. And
I agree with you.
Tell me why. I want to know why. I say, good, excellent. Yeah, I'll tell you why. So I explained to him, hypertension is called the silent killer. So high blood pressure is going to go up, and you will not notice any problem with your blood pressure unless someone check. Either you check yourself or someone else check it for you. And if you come and get your blood pressure checked at least once a month, and it's a quick visit, in and out, how's everything, look at the blood pressure, look at the medication, look at the blood test, make sure all the electrolytes are in order, then you practice in preventive medicine.
That's fantastic.
Okay, if we practice the old-fashioned way, we say, okay, stay home. When you get a heart attack or stroke, if you're still alive, come to see me, and then we'll try to get things under control. That's not the right way of practicing medicine.
And you really like preventive medicine, don't you?
I love it's my passion. I would marry preventive in a heartbeat.
Yeah, I know you do.
I see her on the street, I will jump all over her.
I know you, and actually, then you're saying that sleep apnea taking care of it is prevention.
It's prevention. That's why I thought it's a great topic. It goes right along with my philosophy. Because if we detect sleep apnea early, and if we bring out and educate people, because in another couple I have maybe a year ago, I had a couple, the husband was slightly obese, and the wife was kind of skinny. And the husband said, I want you to see my wife too as a patient. I said, sure. So she sat on the exam table. I'm looking at the patient, and we're talking about sleep problems. She said, no, I have no sleep problem, but I'm very tired in the morning when I wake up, and I wake up with a headache. And I said, well, do you snore at night? She said, no, I don't snore at night. My husband, maybe look how chubby he is, but I'm so skinny. I said, well, people can have sleep apnea even if they are thin. So a lot of people think that sleep apnea means obesity, and that's not completely true. It's more prone in men, it's more prone in obese individual versus a thin person, but a thin person can have sleep apnea because the mechanisms still are the same. Another risk factor is the circumference around the neck. When the person has, if you measure the circumference around the neck, and you have 17 inches or more around your neck, you are more prone to sleep apnea than not.
Oh, let's say that again. 17 inches or more around your neck, you are more prone to sleep apnea.
So being a male, that makes you twice likely of having sleep apnea. As we age, 2 to 3 times more often, men and women over the age of 65 will develop sleep apnea than younger. The use of alcohol, sedative, and tranquilizers will make you a higher risk compared to those that don't drink, no sedative, and no tranquilizer. Smoking makes you 3 times more at risk.
Smoking makes you more at risk for everything.
Now you get this one. This is a good one for, especially for people like in this country. When I go to Germany, I go in and I sit down and have my breakfast, and then when I have to go to Mainz, it's like 45-minute walk. And I'm sure you in Russia, it's a lot of walking, right? So in Europe, all over this, all this countries, people do a lot of walking. When I go to Italy, it's a lot of walking going on. In this country, we get out of bed and we shower, we get ready, we sit in a car for who knows
First
how long.
We sit on the toilet.
We sit on the toilet,
okay.
right? That's the first sitting.
Right.
Then we sit in. Sometimes we even sit to brush our teeth in front of the mirror. Oh yes, I see a lot of people. They have a little chair so that they can sit and brush their teeth and put their makeup and what have you. Where Europeans are more prone to putting their makeup standing up. We are accustomed to sitting. We are too comfortable. We get in the car. We are sitting again for who knows how long. Then you go to work, and if you work in a sitting position. What one of the studies noticed that being a prolonged sitting tend to bring a lot of fluid into the lower extremity. That's why you see so much swelling of the ankle in developed country.
We should be standing. Why are we
sitting?
Should be standing. I never.
We should be. We
no,
did
I know. I always
standing
stand.
Up.
I don't know why we do this. Next time you come, we're standing. Go ahead.
But don't worry. When we are at work, right? We're standing all day.
Of course you are. No, of course you are.
Ina works standing up.
Well,
Patricia works sitting down. Mina works standing up. So sitting for a prolonged period of time, what happens? You bring a lot of fluid to the lower extremity. Then when you lie down, that fluid rushes to the lungs and to the neck.
Oh my goodness!
So lo and behold, the person that sits too long, they are more prone to developing sleep apnea. Now you will say, well, that's good and dandy for people that are up and about. But now let's think of the handicapped, people on a wheelchair that are in prolonged sitting because they have no choice.
Yeah.
So they are at risk of a sleep apnea.
Yeah, we really did. Let me give your phone number again. It's 954-489-
1345.
I'm gonna let.
Did you bring the parakeet?
The parakeet, no.
1608 East Commercial Boulevard.
It's so funny. 954-489-1345. 954-489-1345. And since we're very close, I have a question to ask you because you brought it up about, and I always kind of throw you curves. You were talking about in your throat you have this and that, and you talked about tonsils. Tell me about why don't we have tonsillectomies very much anymore? We used to have them all the time.
Oh, it was.
Could that cause sleep apnea if you have a tonsils that you shouldn't have?
No,
it's nothing to do with it.
No, it will not. Because it's the muscle. When the muscle relaxes, the breathing pipe will close because the tongue will just fall back.
Okay.
And will snapshot the breathing pipe.
Okay.
So the tonsil, no, it's not a problem. Why we don't take them out? Because immunity depends on different parts of your body, including your tonsils. So unless you're having a problem like a chronic infection of the tonsil, then those are the unfortunate people that need to get the tonsil taken out.
So really, tonsils are a good thing, but we remember. Do you have your tonsils? I have mine. Do you have yours? Oh, we all. But years ago, little kids always had tonsils taken out, but they don't now.
If I'm hungry, I bite my own tonsil.
You bite your own tonsils. I think with that, we're getting very close to the end of the show. But sleep apnea, this has been a good conversation. We are coming out with the next issue, the June issue.
If you have sleep apnea.
Yes.
If you're going to go for surgery and you have sleep apnea, you are at a higher risk of complication from surgery than a person without sleep apnea.
Because the anesthesia.
We're going to write this article. This is going to be a wonderful article.
Okay, but wait a minute. So you're saying the anesthesia then, if you're having an operation, is giving you even more problems.
The body won't be able to undergo, because when you undergo anesthesia, right, you're going to depend on the reservoir of your body to keep managing all the functions of the different organs. When you already been suffering from sleep apnea, you've been using your reservoir of your body, including your brain and all of that. People with sleep apnea, they are more prone to Alzheimer's.
Okay, we're all going to sleep now.
And depression.
Good night, everybody. We still have another half an hour to go.
We are open today. We're just kidding. We are open today. Come and see us.
He's halfway out the door right now. Thank you very much, Dr. Mencia. As usual, I always learn so much. I know our listeners do. I know your patients do. And thank you very much for coming this morning. We're going to take a break, and then we're going to go to our next guest.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.